I posted this on LinkedIn with kind of a tongue-in-cheek post saying like, this is probably the most offensive thing I've ever written, and people actually got offended by it, and they didn't read it, so I thought that was kind of interesting. Anyways, you might find offense in this, I don't know, but this is a conversation we need to have. So basically my whole shtick is I think we're in the middle of the greatest social, economic, political, technological revolution in human civilization. AI is going to fundamentally disrupt everything we know about life, and so we're going to have to create new systems and institutions and processes to like exist in society. And so one of the things that, and there's a lot of things that are like tangentially related to all of this, so like things that might not seem connected actually are connected based on the way our systems are set up now. So basically at some point, like this, what we have set up now in terms of, you know, the value proposition of going to work, earning an income, paying taxes, and how those taxes are distributed, it's not going to be sustainable. So something new is going to have to replace it. And I think the point of instability is going to come within the next probably 5 to 10 years, when the vast majority of people have been displaced from their jobs. No new system for replacing income has been implemented quite yet, and there's an inversion in our economic, like in our social safety net, such that like there are too few workers and too few taxable incomes supporting a greater number of people on the top. And of course, like there's different ways to approach this, right? Like some people are gonna say, well, we need UBI and we need to tax the rich and tax corporations more. Like it doesn't matter how it's done. The fact is, like, we don't have an agreement right now on what that looks like, and like time is rapidly running out to like implement something. And so I think we're gonna have to start having real conversations sooner rather than later, because I think the conversations we're not having about who pays for things in the future is going to become a major flashpoint politically for us here in the United States. So one of the big flashpoints I see is with healthcare. It's like comically unsustainable. I think like it's the largest debt of any like debt that Americans carry, because like our system is just so messed up. You know, I saw one, I don't know if this is true, I saw one woman post some bills like on a YouTube short, but she posted some receipts she got from recently giving birth, and it was like $40,000 just to like pop out a kid. So like the healthcare system is broken. Unfortunately, I don't think we're helping ourselves either. While the healthcare system is getting harder to manage, I think it's also a system that's based on sick care, and it's designed to treat symptoms without solving for underlying chronic conditions, and a lot of those underlying chronic conditions are the result of our lifestyles, what we eat, how little we exercise, environmental toxins, pollutants in our water, all that kind of stuff. So there's been a push lately, Jillian Michaels talked about this on Joe Rogan, but there's been a push lately to accept fat people. And like, I want to be very distinct here. Like, I'm not talking about like a woman who is a little curvy and has like 10 or 20 extra pounds. I'm talking about like that 600 plus pound woman who was making the rounds on the news because her Lyft driver refused to pick her up after like he showed up and she was 600 pounds and like he didn't think she would like fit in his car. Like that's what we're talking about here. Like we're talking about like the people in my 600 pound life, like they're really like grotesque people who just like, they're morbidly obese, they can't move, like they can't move without assistance. Like day-to-day life is a struggle. Okay, I'm not talking about like the soccer mom who has let herself go and wishes she had time to go, you know, back to the gym. I'm not talking about someone who's like, you know, maybe looks good at like 150 pounds but is 180. Like, I am talking about the morbidly obese people here who are like you see them when you're out. Like, you have, you know, 20-year-olds who can't walk and they're on scooters at Walmart that are designed for like people who are handicapped or the elderly, right? Like just people who can't move. So like there's been this movement now to like accept all bodies being healthy, and that's just like not biological reality, right? Like if you consume more than you expend, like your body is not healthy. And obesity is a symptom that like your body can't sustain itself. And the logical conclusion of that is at some point your body will stop working. It's like if you if you put diesel into your gas tank, like your car wouldn't work. You would kill your car. So it's the same kind of thing. So we're accepting obesity as like, you know, people can't help themselves, it's genetic, and, you know, oh, by the way, if it was genetic, like, why weren't there as many obese people in like the 1900s? Like, you can watch old videos and look at pictures, like, obesity wasn't a problem back then. So like, if it was genetic, those genes didn't, like, did they just magically start appearing at the same time that like ultra processed foods started appearing? Like, someone like show me the evidence that genetics have always existed for obesity, and like all of a sudden they're just starting to magically manifest. Because it's, you can, you know, watch footage from like the 1990s, not even the 1900s, 1990s. Go watch like a YouTube channel that has like just random B-roll of folks walking around a shopping mall. Like, there's not as many obese people as you see today. There's not even fat people. It's not. So one of the problems why I think this is becoming an issue is because, like, again, like lifestyle, we're just like consuming way too much. Like, so the average American consumes about 3,600 calories per day. So to put this into perspective for you, I run marathons. So I'm like, I wouldn't say like I'm like athlete fit, but like I'm, you know, healthy for where I need to be. I could lose a few pounds, but like I'm not like crazy. I'm not, you know, obese or anything. When I'm in training, so when I'm you know, there's 18 weeks of training in a marathon to get ready for one. So I'm running anywhere from, you know, 20 to 50 miles a week. I've been burning maybe like 2,200, 2,500 calories a day. So nowhere near this 3,600. But when I do run an actual marathon, the marathon itself, I'm probably burning close to 3,000 or 4,000 calories. So basically, to substantiate this level of food intake, you basically need to run a marathon a day. Like that's what you need to burn to like balance out. And the problem is, though, on top of this, is that a lot of the food people are eating, it's like ultra processed food with sugar. And so it's supposed to be addictive. It's been biologically engineered to be addictive. And it's not real food in my opinion. Like, Chick-fil-A nuggets that's not real. I mean, I'm vegetarian, so what do I know? But like, I don't think Chick-fil-A nuggets are like representative of real food. Like, manufactured food isn't real food in my opinion. We can agree to disagree on that. But yeah, like these people, and like I'm envisioning right now, again, like you can watch these videos on YouTube, watch My 600-Pound Life, but someone who's going through, you know, the drive-through, and they're buying enough food to like feed a small army, and that's what they're consuming multiple times a day. And they're not, like, of course they're not exercising, they can barely walk. Like, it's just, it compounds. Like, the negativity compounds to a point where, like, if you don't change your habits, like, obesity is inevitable, and then health complications arise from that. And so basically what's happened in our society, and why I think like fat acceptance is problematic, is because we're basically paying for people to like poison themselves with unhealthy food, and then we're also paying the health complications that come from that. So the majority of, and I'm not gonna say this is everyone, but like there's a high correlation between people who are on public welfare programs, who consume unhealthy foods, and like having obesity. So there's a correlation between like you're on SNAP benefits, you're buying like sodas, and this isn't everyone, of course, but like there's a lot of people are, and there's factors about, you know, for this too. Like, there's a correlation between poverty and inner cities and food deserts. And so like I'm not necessarily blaming the SNAP recipients for it. Like, this just is what it is. Like, this is the objective reality that like people who are on SNAP tend to spend their money on ultra processed foods, and those same people also qualify for Medicaid, and they require medical attention because they're buying garbage food and eating garbage food, right? And so if you think of this from like a economic disruption, job displacement perspective, like if until we get UBI or whatever, like more and more people go on SNAP and like Medicaid, like the likely and they face like, you know, there's going to be a mental health crisis with losing jobs en masse, right? So like you're not going to be in a good place. You might be seeking out comfort through food. So if you put all that together, like you're going to see this increase, right? Like just like it's just a storm that's brewing, and it's going to increase. So we need to like pay attention to this now before it gets out of hand. And I don't think like accepting health at any size is the answer. So let's dive in here. I think, like I said, I think obesity is a chronic, it's a chronic disease. It's a symptom of chronic disease, and that's attributed to our lifestyle. And one of the problems with this is that like we have a healthcare system that's a sick care system, so we're in the business of treating symptoms rather than curing them. I highly recommend reading the book Good Energy by Dr. Casey Means. It's a phenomenal book. It really kind of makes it easy to understand like the problem and why so many people are struggling, and really what the root driver of obesity is. And I'll link a review I wrote of it as well in the description. But I highly recommend looking at this, because I think it helps you understand like why we've gotten to this point and why like obesity is out of control. And so this is like costing us a ton of money, right? Like we're paying for it whether you realize it or not. So I had my good friend ChatGPT here help me come up with some data points on this. So if you compare GDP spending on healthcare in the United States to other countries, and you look at it alongside our rate of obesity, there's an obvious like correlation here. Like Sweden only spends like just under 11% of their GDP on healthcare, and their rate of obesity is like a fraction of ours. And Sweden is a Scandinavian country, and that prides itself in like public healthcare. So it's like they spend more on public goods, like they're medicated, like they have universal healthcare, right? Like they have like better healthcare than we do, and they're still spending less, and they have less rates of obesity. So like clearly we're not doing something that's right here. Like clearly we're doing something that's wrong, and we need to fix it, because if we continue letting it get out of control, like it's not going to be sustainable. And like I said before, if we're going to get to this point where our current system of employer provided healthcare coverage and taxing incomes to support Medicaid and SNAP and all these benefits, like that's not going to be sustainable. So we need to fix this sooner rather than later. So one of the big problems, and I'm not saying like this is the only cause of our, you know, healthcare crisis. Like, of course, you know, pharmaceutical companies and insurance companies are, you know, gouging hospitals, and like the whole business model is broken, right? But like obesity isn't helping either. So the annual cost of adults with obesity is significantly higher. It's almost double that of someone who's at a normal weight. So there's one NIH study that showed that obese adults are going to cost around $5,000 for every like $2,000, $2,500 that someone at normal weight would cost. And it's a lot higher. Like the more obese you are, the higher it goes. And that's because obesity amplifies the cost of providing medical care. And again, this isn't like trying to be mean. It's just like, it's literally physics. Like, right? Like if you weigh 1,000 pounds, like I was looking when I was doing research for this, there's a guy in Kansas who weighed 1,000 pounds, and he had to go to the hospital for something, and the ambulance couldn't physically move him, so they had to rent like a truck like you would get to haul, like move a car, basically, like a tow truck kind of thing, like a flatbed. They had to get one of those to take him to the hospital, and then because he's so heavy, like you can't just get a nurse to physically move him. Like you need special equipment to move people like that. So the heavier you are, literally the more of a burden you are onto the people who are trying to help you, right? You need more physical help just moving around, right? So if everyone in the hospital is obese, like you're gonna have to get like hire more people to physically, like you might need teams of 3 or 4 nurses instead of teams of 2 to like move someone, you know, from a bed to a chair or whatever, or even just like to help you go to the bathroom, right? Like you just need more. And these aren't high-paying jobs either. Like that type of like hospital support, home health aides, like nurses, like these aren't high-paying jobs. So like no one wants to do these jobs either. So keep that in mind. Like the people who are grotesquely obese are like exploiting their indulgences, because it's what it is. It's an indulgence in food, and food addiction. Like their indulgences, the burden of that is being shifted to like low income people working like really unpleasant jobs at like the bottom tier of our healthcare system. So like keep that in mind. But like once you're so because you have obesity, like you suffer from a lot more problems, like heart disease, for example. Like your chances of having a heart attack are substantially higher if you're obese. Like that's just, again, like basic biology here. Like if your arteries are clogged and it takes longer for blood to circulate and you have all these issues, like yeah, you're gonna have problems. Like this shouldn't be a debate. And so you're gonna need more healthcare. You're gonna need more support. But then like just other things, like if you have to go for a surgery and if you put in under anesthesia, right? Like the dosages are gonna be higher, the risks are gonna be higher. So like hospitals need to get insurance or whatever to guard against malpractice suits and all this kind of stuff. Like the costs just go up, like the heavier you are, and then the more the population becomes, like the more frequent number of patients are heavier, like it's just exponentially increases here. So we're not just talking about like, you know, one or two people and like isolated instances. Like because obesity is becoming so prominent in our society, like this is becoming an increasing problem, and like the number of obese people is increasing. So right off the bat you can see like we're inverting our support system for these people. Like the staff needed to like help these people just don't exist. They're more expensive, right? And so this is creating an inversion that's not sustainable. And so one of the problems with this is that it's not just putting pressure on like the entire healthcare system, like it's putting pressure on taxpayers to fund the system. So, you know, right now, and I say this too because at some point like obesity interferes with your ability to work, and I cover this a bit in here, but people who are obese, especially and again, I'm talking about morbid obesity here. I'm not talking about someone who's just like a little overweight. Like we're talking about morbid obesity. Like you have difficulty moving around, you have like complications. Like you can't just like hold a normal job. And again, like watch My 600-Pound Life. Any of those people, like I don't think they're working, right? Like they can barely get into their cars. Like they're not driving to a job, and they can barely move in their homes. So they're not like working remotely either. So if you're not working and you can't work because your obesity makes it impossible for you to work, then you're relying on the public benefits system. And again, like I said before, because it's more expensive to treat you, like you're draining more from the system than like you're obviously putting into it. And because our healthcare system is broken and health insurance is such a problem, the cost of employer-provided health insurance continues to rise. So I think this was in the Wall Street Journal put this out, but for a second straight year, I think this was in 2024, health insurance rose 7%. So employers are paying more to insure people, and because the population continues to become more and more obese, the costs of their medical care continue to go up. So I hope you see like the logic of this. Like the more, like everyone's just becoming more expensive to treat because we're treating chronic issues. We're not treating like you're breaking an arm or you're having a kid. Like we're treating conditions that could be resolved through changes in diet and lifestyle. And so this is putting pressure on businesses. So like yeah, large employers can like absorb some of these costs more, but small and medium businesses can't, right? And so I think this is also like it's a negative feedback loop. So like AI is going to displace workers. We're going to have fewer workers, which means they're not going to get health insurance. So they're going to have to go onto the exchange. But then to cut costs, like one of the cost drivers affecting decisions for whether or not employers are going to outsource with AI is medical care. Like if I can, okay, let's use HR as an example, right? So IBM right now has swapped out some HR specialists with their AI agents that they're building. Okay, if I have an AI agent, like it's not going to whine or complain, it's not going to have an attitude, it's never going to be late, it's not going to need vacation time, it's not going to demand a raise, and I don't have to pay insurance, I don't have to provide insurance for it. Like there's no requirement to provide health insurance. So right off the bat, like I don't, like someone who's smarter than me, like quantify the cost savings here, but it's tremendous. So if you're a small to medium business and you can pay OpenAI or IBM or whoever like a few $1,000s a month to license one of their agents to do HR work, like you're gonna do that, right? Because you're not gonna have to pay for these costs. So there's an incentive now to like get rid of employees, like human workers, because of the costs, and healthcare is one of those costs. And so then you're only going to continue escalating and exacerbating the number of people who are out of employment, who are going to need to be on publicly funded insurance because they don't have an income, right? So you see where this is going. Like this is going to be a huge problem. And so the burden will be placed on, the burden of displaced workers is going to be placed on the healthcare system, but because of the constant prevalence of obesity are concentrated in a demographic that isn't contributing to the economy, or at least they're not contributing as much as they could, it's going to require healthy people to foot more the bill. And if trends like this continue within the next decade, there will be fewer healthy people supporting a growing number of obese people. So like, this is a pyramid, right? Like imagine the pyramid. Like the healthy people are at the bottom of the pyramid. They may or may not have jobs, like that's a whole separate issue, but healthcare is a cost that is driving AI adoption for employers. But you're going to have fewer number of people at the bottom of this pyramid here, supporting a greater number of people up top, and the more obese people become, like the more expensive they're going to be, the more dependent they're going to be on public benefits because like they can't work. And so like this is not a good place to be in. Like this is going to become a fundamental problem. You know, and here's I'll link this video, but again, there's like people on YouTube who are making content as like influencers, like just engaging in gluttony. Like that's the only way I can describe it. So this is a thing. I'm not like making this up. These people exist. And so who's going to pay for it? Who pays for this? Like, are healthy people going to pay for it? I don't think so. So I think there's kind of two options that are going to be possible in the future. So the first is that obese people are going to be taxed directly. So we've tried indirectly taxing through products, and that just doesn't work. Like I think both New York, I talked about this earlier in this essay, but New York and Philadelphia tried to implement a soda tax, and like people are still, like obesity still continues to rise. So you're not actually solving the problem, and like companies like Big Food has an interest in continuing to sell products, so they'll do what they need to do to like shift, like tweak the calorie count or whatever, but to keep you still addicted to their products. So we're not actually solving any problems here. Okay, so we have to potentially consider like taxing obese people. Like again, I'm not talking about people who are just slightly overweight. Like I'm talking about people who are deliberately going through the McDonald's drive-thru and grabbing all of this garbage this woman has here, two burgers, a bunch of chicken tendies, and a Shamrock Shake and a soda, right? Like I'm talking about these people. Like we might need to start taxing them to disincentivize this behavior. And so I think, and this is something that an economist published in the American Enterprise Institute back in 2007, but kind of in the same way that we're expected to self-report our income to file our taxes, I think we might see a fat tax requirement where the IRS could use BMI as a way to assess how much tax you need to pay and whether or not you qualify for programs like Medicaid and food stamps. And I'm sorry that that's harsh and brutal and people might find offense to that, but like with all due respect, like, you know, maybe I'm selfish, but like I put in the reps. I wake up every morning, go run, work out, you know, take spin classes, I go to the gym, like I eat healthy, I manage what I eat. Like I do not want to pay for you to go like eat all the ice cream and Oreos and cookies you want. Like you have to exercise discipline and respect yourself. And to me, when I see people like this woman in this thumbnail, like it signals like you don't respect yourself. It's like, why should I work hard every day and in order for you to keep disrespecting yourself? Like there's just a fundamental like value misalignment there, and maybe that's like my inner conservative coming out, but like I don't want to pay for your gluttony. Like I'm not asking for a tax write-off for all of my marathon fees. Like those aren't cheap. I'm not asking for a tax write-off like my gym membership, like maybe I should get that. Like I'm not asking for that. I'm asking for people to like be accountable for their behavior and their actions, and like I don't want to be someone who is going to have to pay for it. And if we get to a point where that becomes reality, like it disincentivizes the creation of business, right? Like, you know, I could be in a position a couple of years where maybe I might need to hire someone, right? And so if my option is to hire a virtual assistant who lives maybe in the Philippines to license an AI agent, or to hire an American worker who I'm going to have to pay health insurance for, like what option am I going to choose? I can tell you which option I'm not going to choose. Like it disincentivizes me from hiring American workers if I have to pay, you know, high taxes, or if I have to pay more out of pocket to support their healthcare needs. And then from a tax perspective, like if I have to pay more in taxes, so more of my income can go to support like more and more people who need to generate like healthcare services from like Medicaid, or they need to be on food stamps, like it disincentivizes me from wanting to work. Like I know for a fact, like I have family members who I know for a fact they collect money they're not earning to sit around all day eating Cheetos, watching TV. Like I know for a fact this is happening, and it's happening I think at a much higher rate than I think people realize. And so like why would I work hard? Why would I work hard if that's where my money's going? You know? So I think there's like a psychological problem here too, and like it's hard to incentivize people to work when they know this is happening. So I think we might need to tax obese people. Unfortunately, I don't think that's going to be a politically viable option for obvious reasons. So the alternative, I think, is going to be even worse. But I think this is what's going to happen, is we're going to see a rise of sovereign patients. And so rather than relying on a broken medical system and a system that caters to sick care rather than healthcare, I think people are going to start opting out. And I think those who have the means to do so are going to start piecing together bespoke healthcare plans that meet their needs, rather than supporting everyone else. And so just to like give you an example of what this looks like. So I currently do not have health insurance. I'm on a health share. And so what that means is like anytime I need to go to a doctor's appointment, I would have to pay out of pocket. So when I get sick, right, like there's a strong incentive for me to like treat myself with over-the-counter stuff. Obviously, like where the health share comes in is like if I break a bone and I need to go to the ER, I'm gonna be able to go to the ER as a self-paying patient. So I'll be able to negotiate a much lower fee because I'm not paying the insurance rate. So I'm gonna be a self-paying patient, and because of that, I like have an initial amount that I'm expected to contribute, but after that the health share should kick in and cover the rest. I caveat this, like I don't really use a lot of medical services, so I don't quite know, like I don't think it's a scam. People wouldn't use it if it was, but I don't, I haven't gotten like $100,000 medical bill to like prove that this works. So if you have, like, I would love to know. Similar things like the Amish do something similar where like people like share and pool resources. So I think we're going to see more and more of that, especially too because health shares have up until now been really religious in nature. I think we're going to see more secular health shares cropping up for people who are healthy and have a decent lifestyle and don't want to be charged out the wazoo to pay for chronic conditions of everyone else. So I think we're going to see more of that. I think we're also seeing like new access to medical care that we haven't seen before. So Function Health is one example. You can get blood panels done and like evaluate your metabolic health for yourself. You can look and see what your like cholesterol is and your glucose and all that kind of stuff. And then you can use a tool like ChatGPT to analyze the results for you. And then you can like, fix the results. And so let me like give you a real world example of what this looks like. So I have psoriasis. I've had psoriasis my whole life. It is 100% the result of lifestyle. I can tell you that fact. I have pictures and evidence to prove this. So when I have not taken care of myself, I've had crazy flare-ups where like the psoriasis will cover like 60% of my body. And now, like, I have, you know, some spots here and there, but like for the most part, like, it's not noticeable, right? So I'm not going to a dermatologist, I'm not using creams, I'm not using steroids, I'm not using any sort of pill, like, I'm not on a pharmaceutical. I treat it 100% with diet and lifestyle. And I know when I get a flare up, like, I need to, like, maybe dial back on the sugar, right? And so I think we're going to see more, like, that's a great example of a lifestyle related illness that, like, or condition that people seek medical care for that you really don't need medical care for. So I'm not talking about, like, cancer. I'm not talking about, like acute issues like your spleen, like, ruptures, or your appendix, or like you break an arm. Like, I'm talking about, like, things you can treat on your own. Like, maybe you have an elevated thyroid issue, maybe, like, I have a skin condition. Like, you have things, like, you can treat on your own. And so I think people are going to access, you know, data, more health data, using wearables, doing blood draws, using tools like Function Health, AI, to, like, figure out what's going on in their bodies. And then from there, like, people for routine things, like if you get strep throat, for example, like Amazon, and again, I haven't used this, so if you have, please let me know, but, like, Amazon offers, like, telemedicine and a fraction of the cost. Like, I could pay $49 on Amazon One Medical and get a telehealth appointment and get treated for strep throat. Like, you know, don't need to go to urgent care, don't need to go to the doctor. And so I think more people are going to start opting for those, because I think for the vast majority, like I've had the flu before, I've had strep throat, I've had ear infections. Like, you know when you're sick, right? Like, you know. So I think we're going to see more of that. And so what is going to happen, and I think people talk about this, like the haves and the have-nots and the wealthy, and I don't think this is going to be like the wealthy, or it's just going to be like, you know, Jeff Bezos and Elon Musk having, like, special medical care, although I think that will happen to an extent. But I think we're going to have a two-tier health system that's going to emerge. And those who can afford and who are willing to pay, you know, $500 for a Function Health membership, and, like, the blood draws, like, get the continuous glucose monitor. You know, I have my Garmin. Like, people are going to pay for, you know, tools. I pay like $80 a month for MyFitnessPal, or $80 a year for, like, MyFitnessPal. Like, all these different tools, I think people are going to start piecing them together, and then, like, having emergency funds for, or, like, the health share, like I have, for, like, emergencies, right? And I think we're gonna start seeing a two-tier system where there's people who are gonna be on the public system, and it's gonna be crap, and it's gonna be low quality, it's gonna be awful, and then people who are gonna be doing bespoke stuff, and they're gonna be looking for alternative health care outside of insurance provided by an employer. And I think this is cause for concern. Because, okay, if you are obese, you think you're entitled to certain medical rights. Well, if all the people who are paying your pooling your health insurance at work, or if employers are cutting costs and they're, like, outsourcing to AI, if all of the, like, people you've relied on up until now start opting out of the medical system, and, like, there's fewer taxable incomes to tax to provide you with your benefits, like, something's gonna give. Something, like, literally under the weight of the system, no one is going to be able to continue. Like, the status quo isn't going to be able to continue. So something's going to have to give. So what are we going to do here? And I do, like, we need to really start considering the options. So I've laid out two here. I think taxing obesity directly. You know, in the same way there's sin taxes on alcohol, like, gluttony is a sin. Like, maybe tax it. Like, again, not politically viable, but I think maybe that's an option. The other thing is sovereign patience, and I think we really do need to pay attention to this, because it's going to fundamentally disrupt the healthcare system as we know it, who gets access to it, and then none of this fat acceptance stuff is going to matter, because you're not going to have any there's not going to be any resources to pay for it, right? And so, like, I think we need to find a middle ground. Like, I'm not saying, like, we should take away healthcare for everyone, but, like, this isn't sustainable. So we need to come up with an alternative solution, and someone has to pay, someone has to foot the bill. And who is it? Like, asking triathletes to foot the bill of stars who are on my 600 pound life is just not viable. So we need to come to an alternative. So I would love to know your thoughts on this. I'll link this full essay if you want to read it for yourself in more detail. There's citations and stuff. You know, that'll be in the essay. But I would love to know what you think. Like, who should pay for fat people? Like, at what point do we start, like, holding people accountable for their choices and their lifestyle decisions? Like, at the end of the day, no one is holding a gun up to your head if you go through the drive-thru and you order, you know, like 2 Big Macs and chicken nuggets and a Shamrock Shake and all this kind of stuff, right? Like no one is forcing you to do that. Like that's a choice you're making. And there's arguments to be made about addiction and all that kind of stuff. But at the end of the day, like that's a choice. And so at what point do we start holding people accountable for the choices, and who should be responsible for lifestyle related healthcare costs? Whose burden is that? And as we move into this AI powered world where employment is no longer guaranteed and health insurance is no longer provided by employers, like what does healthcare look like? We can't all possibly go onto publicly funded healthcare because, again, the costs are too high, right? The costs are so high with how we have it set up now. So we're going to need another system. And I think sovereignty and sovereign patients sovereign medical care might emerge, and it's going to create a difference between the haves and the have-nots, and who gets access to what and what that looks like. So I would love to know your thoughts. If you found this overview helpful and thought-provoking, please subscribe, share. I would greatly appreciate it. All right, toodles.